Hi everyone, welcome to week 5 of our course. This week we'll be talking about the patient or the individual's experience of illness or disease. It may not come as a surprise that there is not just one type of illness out there. There are a variety of different kinds of illnesses. We can define illness in a variety of different ways. Sometimes we might say sickness or disease, but there are also chronic illnesses which could manifest as disabilities. We can also look at different categories of illness. We have physical illnesses and mental illnesses. Physical illnesses being more those illnesses affecting the physical body in the sense that it could be an infection like a bacterial or viral infection. This tends to affect the biology of the physical body, but of course we know that mental illnesses also have an effect or an interaction with the physical body as well. We can also look at minor versus severe illnesses. We'll get into a little bit more detail about what that might mean, as well as chronic versus transient illnesses, meaning either illnesses that last for a long period of time or illnesses that resolve rather quickly, being those transient illnesses. For some more detail on chronic illnesses versus transient illnesses, a transient illness would be one that is curable. So typically you'll recover in a relatively short amount of time from a transient illness, typically less than or about 1 month. This would be something like the common cold, the flu, certain STIs, chlamydia, or strep throat. Strep throat is not an STI, of course, but mononucleosis, UTIs, any of these kind of more short-lived types of illnesses would be transient illnesses. On the contrary, a chronic illness is going to be an incurable illness, but a treatable one. Typically, you would consider an illness chronic once symptoms have persisted for 3 months or longer. A lot of the time, if someone has had symptoms for 3 to 6 months, that is that point where physicians will be starting to call that a chronic illness. Those symptoms have continued without going away, without improving for 3 to 6 months or maybe longer. Some examples of chronic illnesses, which a lot of the time we might also consider disabilities, would be HIV or AIDS, the human immunodeficiency virus, or acquired immune deficiency syndrome as a result of a long-term HIV infection. We also are seeing more cases of long COVID. This is going to be that long-term effect of a variety of different symptoms. We're seeing a lot of different variation in long COVID patients, but those who have had a COVID-19 infection, who have persistent non-improving symptoms after their initial infection. We also have conditions like endometriosis, interstitial cystitis, multiple sclerosis, herpes, and there are so many other examples here, but it's really different when we're studying chronic illnesses versus transient illnesses. The way that research can look and the way that those populations' lives can look are very different. Particularly for the chronic illness and disability community, we see a lot of very unique experiences for those who are living with illness symptoms or chronic pain for months to years or an entire lifetime, compared to those who may have a very severe transient illness or maybe a less severe transient illness. That's going to really be a very different patient experience depending on which category a person's illness or sickness falls into. We tend to focus quite a bit on the United States in this class, and of course we do still have a global perspective depending on the topic, but since a lot of us are living in the United States, this is something that's probably fairly relatable to many people. Drawing directly from one of our readings this week, I would like to discuss kind of what the diagnosis and chronic illness experience looks like for patients in the US. So we have this process, these 4 steps that most people tend to experience in the process of becoming chronically ill or adjusting to becoming disabled in the United States. So first, a person will seek out and hopefully receive a diagnosis. Then they have to go through handling the dilemmas of disclosure. And this would just mean, who do I tell about my chronic illness? How do I talk about it? When is the right moment to disclose that I have a disability or that I have a chronic illness? Third, dealing with an unruly body or living with that, that lived experience of symptoms, pain, unpredictability, a dynamic nature of change in the body and the ability that that person has to function with day-to-day tasks on a day-to-day basis. And fourth, potential to experience exclusion or ableism as a chronically ill or disabled person. So let's break down some of these categories and some of these steps into a little bit more detail. So when it comes to the diagnosis experience, this is going to be a very individual experience depending on a lot of different factors for an individual who has an illness, as well as countless other factors as far as that person's socioeconomic status, their race, their gender, the region that they're located in, and the type of illness that they have, the type of symptoms that they have. There are a lot of different nuances to this topic. But for most people, a big part of the diagnosis experience is the expense. Regardless of what kind of insurance a person has, there are going to be expenses attached to seeking out a diagnosis and receiving a diagnosis. You have to see likely a lot of specialists if you are seeking a diagnosis for anything that's not extremely commonplace or something that could be diagnosed by like a general practitioner. And so, particularly for individuals who do not have insurance or individuals who are lower income, that expense can be a massive barrier to seeking a diagnosis. And a lot of people don't have the opportunity to seek a diagnosis because of the immense barrier of the expense that comes along with seeking that diagnosis. We also have a time commitment that's necessary for seeking a diagnosis. This might mean, seeing several different specialists, being on months-long waiting lists, getting referrals through, a general practitioner to another specialist, and it's really just kind of, a Sherlock Holmes situation, kind of trying to get to the bottom of, hey, what is causing these experiences? What is causing these symptoms? It's unfortunately not a very cut and dry, super easy process where you can just go into any old urgent care, tell them what's going on, and immediately leave with a diagnosis and a game plan. A lot of the time, it's going to take a very, very long time, sometimes even years, to get a diagnosis for different kinds of chronic illnesses. To share a little bit of personal experience, I am, of course, somebody who has a disability. I have my own experiences with chronic illness and chronic pain, and it has taken several years, sometimes even over a decade, depending on the condition that I've sought a diagnosis for. It can be very, very difficult to find doctors who are knowledgeable about certain rarer diseases. And so this is something that a lot of individuals and patients in the U.S. are struggling with. We might also see misdiagnosis or non-diagnosis. So misdiagnosing a person would be giving them a diagnosis that is not actually what's going on with them. This can happen a lot for different kinds of neurological disorders, say seizure disorders or migraine disorders, being misdiagnosed as potentially mental health conditions, but also other neurological disorders. We might also see no diagnosis for individuals who are just not able to get answers. Maybe they have seen those specialists, maybe they have gone through this, process of time commitment and expenses and seeing all these different doctors, and they just can't find anyone who gives them an answer yet. In this case, I like to say that you really are the one that knows your body the best, right? For an individual who's going through chronic illness or disability, a lot of people can tell. They're like, hey, something is not right, something is off, something is different. I know that something is wrong. And they might be dismissed. They might be told, no, that's normal, no, it's okay, and not receive a diagnosis when they could very well actually have a disability or an illness that has a diagnostic label, and they just haven't seen a provider yet who is aware or is willing to give that label to them, to give that diagnosis to them. That, of course, falls under this fourth bullet here, uninformed providers. Not every doctor knows everything about every disease. That would be really cool if they did, but there's just a lot out there to know. And when it comes to rare diseases or diseases that are not as well researched or well understood, A great example that comes to mind is Ehlers-Danlos syndrome. That is a connective tissue disorder that is getting more research recently, but for a long time it was very under-researched. And so a lot of providers, through really no fault of their own, just were uninformed. They just didn't know very much about that condition. And then, of course, when it comes to diagnosis, there are a lot of different treatments out there for a lot of different illnesses, and not all of them are very helpful. Sometimes a person might be given a treatment that is completely ineffective. It just doesn't help them at all. It's not useful for either their situation or their individual biology or whatever the case might be. But there also are harmful treatments out there. If someone is misdiagnosed and treated for something that is not their condition, that could potentially lead to harm. There are also just a lot of different factors at play here, and it's really, really important to have an informed provider who really, really listens so that we can minimize the expenses, time commitment, and these other potential problems with the diagnosis experience. In researching the diagnosis experience, medical sociologists as well as other medical professionals are really interested in some of these other individual experiences. One being, of course, psychological distress. There are a lot of diagnoses that can be very, very distressing. In particular, fatal diseases, being diagnosed with something like terminal cancer, that is very psychologically distressing for most people, probably everyone. And so in that case, we want to look at what can we do to support people in that kind of situation? What is helpful for that kind of situation? How do people cope with these kinds of situations? We also, of course, can see self-image struggles upon receiving a diagnosis, fatal or not. In particular, the loss of independence or needing to rely on other people or forego certain activities that a person might enjoy pre-disability or pre-chronic illness, that can be quite a struggle. A lot of people, find it to be rather traumatic to adjust to a disabled life after having a non-disabled life up until that point. That is not to say, of course, that disability is always traumatic or that becoming disabled is always traumatic and a bad thing. A lot of people have the opposite experience as well. A lot of people find that receiving a diagnosis and taking on that disabled identity can be really empowering and that they can have a really, really awesome life with that identity. But of course, that adjustment is an adjustment and it's not always easy for every person. There's a lot of grieving that might come into play when it comes to adjusting to this new lifestyle, this new life, to relying on other people potentially, or to spending more time in medical facilities, seeing more doctors, or having, more medical expenses, or more investment in medical treatments, or perhaps, having to disclose more often to loved ones or to workplaces about your chronic illness or disability. There are a lot of very difficult experiences that can go along with this process. There are, of course, positives to the diagnosis experience. We've talked a lot about those very difficult parts, but getting answers can be really, really validating and really, really helpful, particularly for people who've been dealing with symptoms for a long period of time or very severe symptoms, even for a short period of time. Getting that label of, hey, you have this disease, you have this illness, you have this disability, that answer can open up the door to a lot of new possibilities. Not only is that going to be very validating, where a person will be like, okay, it isn't all in my head, this is something real. Now I can connect with other people who have similar experiences or similar struggles. Maybe I can look into what other people have tried. I can learn more about different treatments that are options that I could use. And that can be a really great jumping off point for, starting to maybe find some relief from symptoms or some community and people to connect with about that lived experience of having a chronic illness or disability. Even with a transient illness, a lot of these can be very helpful, even if it's something that a person will recover from relatively quickly, particularly for very intense, distressing symptoms, kinds of transient illnesses. Getting that diagnostic label can be really, really helpful and really validating. And it's really, really important that this is an opportunity that people are, that is available to people to get that diagnosis. Switching gears a little bit, I'd like to discuss what some people's experiences might be in medical settings. Of course, there are a wide variety of experiences that a person might have in medical settings, again, dependent on so many different factors about that individual and their identities, the region where they're at, the practitioners that they're seeing. There's a lot of nuance to these experiences. One experience that I want to discuss and really highlight here is the experience of medical gaslighting. This is going to be when practitioners or medical professionals tell a patient or they attempt to convince them that their perception of reality is faulty. So you may be familiar with the term gaslighting. That is essentially trying to convince a person or manipulate another person into thinking that the way that they're experiencing their life or the world or their interactions, that's not really right, that they are, quote, crazy, or that they're making things up or imagining things, or it's all in their head. Medical gaslighting is particularly gaslighting done by medical practitioners in medical settings. So this could look like dismissing a person's symptoms, telling them that it's all in their head, or chalking up symptoms that are maybe even more severe to things like anxiety or a person's diet, their sleep habits, their body weight, and so on. Of course, those things can be factors, but a lot of individuals report having experiences like going to the doctor for concerning neurological symptoms and being told that you just have anxiety, or come back in a couple months if it doesn't get better. Just really kind of being dismissive, not looking into that individual's experience or trying to figure out where those symptoms are coming from, just kind of, dismissing and moving on from that interaction. Of course, some people will also have experiences of discrimination or differential treatment in medical settings. It'd be wonderful if this were not the case, but of course we know that medical practitioners and doctors are humans just like everyone else. They have biases, whether they be implicit or explicit biases, and so we might see actual discrimination taking place. Racism, misogyny, homophobia, transphobia, a lot of different kinds of discrimination that could take place in any setting, but it can be particularly troublesome in a medical setting when a person is seeking care. And differential treatment just means being treated differently. Of course, we don't want to treat every single person exactly the same when everyone has different situations. It's important to adjust and meet a patient where they need to be met and to see, really what that person might need in their individual unique situation. But treating people different based off of identity factors such as, race, gender, class, that's where we start to run into some issues that kind of get on this slippery slope towards discrimination. And that's not quite so equitable, not quite so useful for the actual medical benefit or the treatment of those patients. Switching gears to talk a little bit more about specifically the disabled experience, I think it's important to distinguish between invisible and visible disabilities because the visibility of a disability can be really important in the person's experience of their disability and the way that they interact with the world and the world interacts with them. So this might not be something that we think very much about unless we're in a disability studies course or a course like this one, but not all disabilities are visible. There are a lot of invisible disabilities, meaning just disabilities that are not immediately visible upon looking at a person. So this could be things like chronic pain, having a migraine condition, hearing loss. HEDS is hereditary Ehlers-Danlos syndrome, that connective tissue disorder that we discussed a little bit ago. Endometriosis, which is a condition where uterine lining grows outside of the uterus in a person who is assigned female at birth. There are a lot of different invisible disabilities out there. And a person who has an invisible disability, they could very well have a parking pass to park in accessible parking spaces, but you might be able to look at that person and not see their disability right off the bat. These can manifest in a variety of different ways. A lot of chronic illnesses are going to be invisible disabilities. And so the experience of living with a visible or invisible disability is going to be pretty different because people are going to treat you a little bit differently based on whether they can see your disability or not. One thing that is also really important to look at when we're talking about invisible disabilities is this process of, quote, coming out as disabled. When a person is not immediately visibly disabled, if people don't know that that person has a disability, then they might have to disclose that at certain times. This might happen to someone who parks in an accessible parking space where someone says, hey, why are you in that space? You don't look like you should be here. They might have to talk to a complete stranger and say, no, I can park here because of X, Y, or Z reason. There are a lot of other scenarios where you might have to come out as disabled, maybe in the workplace to ask for accommodations, or with friends or loved ones, or if you're in the dating sphere and you need to let people know, hey, these are some things that I struggle with, or these are some things that I might need because of my disability. So that's a very unique experience that only people with invisible disabilities really have to deal with, at least in face-to-face interactions. It's also important to notice that people of any age can be disabled. There is this really common misconception that disabilities are something that only older people are living with, and that's really not the case. Any person of any age can be disabled. You can be born disabled. You can acquire a disability at any point in time. And so people of any age can have a disability, and it may or may not be a visible or invisible disability. But it's really important that we recognize that there's a lot more going on under the surface for individuals' experiences than is really going to be immediately visible. Diving a little bit more into the topic of disclosure, I really liked this concept of dilemmas of disclosure from our reading this week. This is a situation where, disclosing your disability to a person, it can be pretty difficult. Let's think about why might it be kind of difficult to tell somebody that you have a disability or that you have a chronic illness or you suffer from chronic pain. Why is that a difficult situation? There are a lot of reasons. One might be internalized ableism. A lot of people feel some shame about their disability or the things that they struggle with. And of course, that will be due to our society's kind of insistence or belief that disability is a bad thing, a shameful thing, something that is tragic, that we should try to avoid at all costs. And we're not seeing a lot of positive representation of disabled lives in the media, in our day-to-day lives. And so a lot of people are, thinking, hey, it's kind of hard to talk about this with people because I might be the first disabled person they ever meet, or I now have to do a whole bunch of educating on behalf of the entire disabled community or everyone who has my same condition. And that can be pretty stressful. That can be a lot of pressure. But there are a lot of other reasons why it can be difficult to disclose. Talking to employers in particular, especially during the early interview process or onboarding, it is illegal to discriminate on the basis of disability, but a lot of employers might reject someone for a job based on their disability or accommodations that they might need, and they might not say that's why. It is illegal if they say, hey, we're not going to hire you because of your disability, but they might just say, hey, we found someone who's a better fit. And so a lot of people struggle, saying that you're disabled in a job interview can feel kind of risky. Of course, for individuals who have visible disabilities, it might be a little bit more difficult not to disclose. But for those who have invisible disabilities, not disclosing can be tricky because if you don't disclose your disability early in the hiring process, then you may not be eligible for accommodations or benefits later on in your tenure with that company. So that can be a really tricky thing to navigate. When it comes to disclosing with friends, whether it be friends who are present before you become disabled or chronically ill, or friends that you make after acquiring a disability, that can be a pretty difficult conversation to have because a lot of people are just not very informed about these topics. And that's okay, right? We can all learn about these things, but people have a lot of misconceptions and a lot of interesting and kind of sometimes problematic beliefs about disability and what a person with a disability can do, what a disabled life can look like. And so it can be kind of tricky. You might lose friends if you develop a disability or condition that makes it difficult or impossible to do things that maybe you did before with that friend. And there's some adjustment that needs to happen. some changes in lifestyle that need to happen, and not every person is going to be open to that. When it comes to romantic partners, and countless other examples here, but say, if a person is dating or in a relationship when they become disabled, that can be really difficult to talk about for a lot of reasons as well. A lot of people may be rejected for their disability, especially when they're out in the dating world and they're just meeting individuals for the first time. They might think, I don't know, maybe I should kind of keep this to myself until later. Maybe I should wait until I have a connection with someone before I share this part of my identity and experiences. Um, Again, a lot of people just don't know very much about disability, and so they might not really believe that a person with a disability could be a good partner for them, or that they might be incompatible. There's just a lot of question marks because there are all of these misconceptions and ableist beliefs bouncing around in the discourse of our society. When it comes to a partner that a person is with before they become disabled, or maybe someone that they're with through that process of developing a chronic illness, that can also be difficult to disclose, really how things are going, how things are feeling, and navigating that transition with another person. That, of course, can also make it easier. It really just depends on a lot of factors like the individual with the disability, the partner that they're with, what their lives look like, and the type of illness that they're experiencing. But across the board, disclosing a disability or illness can be difficult for a lot of reasons. And there is, unfortunately, a lot of negative and difficult to deal with kind of fallout that could happen in certain situations. But a caveat with that I'd like to add for anyone else who's a part of the disabled community, or anyone who might become a part of the disabled community or the chronic illness community in the future or soon, it's very important to have supportive people in your life. And if someone rejects you or abandons you or questions you because of your experience of disability or illness, it's worth thinking, maybe that person is not a great person to have in your life. It's really, really important to have supportive people that you can lean on and people that you can disclose safely to about these kinds of experiences. People who treat you badly because of having a disability or because of struggling with things that maybe other people don't, or whatever that might look like. Um, it's really, really important to have people that don't treat you badly in those scenarios. So just full PSA to anyone who might be dealing with this. And then also on the flip side, if someone does disclose to you that they have a chronic illness or a disability, try to be open-minded. Just listen to them, listen to what they need, what their experience looks like, and try to just meet them where they're at, and don't question it too much. A lot of people are experts on their own body and experience. So just run with it, just listen to them and move on, and everyone will be better off for it. Moving a little bit away from the discussion of the interpersonal experience of disability and chronic illness, let's talk a little bit about the physiological or the body experience of disability. It is not a secret that having a disability or a chronic illness can be really, really difficult. There are a lot of symptoms that are very unpleasant to deal with, things like chronic pain, vertigo, dizziness, weakness. There are a lot of experiences of symptoms that can be very, very challenging to deal with on a day-to-day basis. For a lot of disabled people, they have what we call dynamic disabilities, where from a day-to-day basis, things change. One day is easier, another day is harder. It can even be on an hour-to-hour basis that symptoms flare up or relax, and it can really just be very unpredictable. It's hard to know next Friday, how am I going to be feeling? Can I go to this movie with my friends? Can I commit to doing this thing for my workplace? You might not know how you're going to be doing that day, and it can be really difficult to plan ahead, and sometimes people might feel like they're being a little bit unreliable or wishy-washy, when really it is at the core that experience, that physiological experience of chronic illness or disability, that can be very, very difficult to make life plans into the future and to deal with on just a day-to-day basis, this constant fluctuation and change. I also want to call attention to a concept that we call spoon theory. This is something you may be familiar with if you're in kind of, mental health discussions or circles on, social media. But essentially what spoon theory is the idea that every person has a certain number of spoons per day, spoons being kind of energy units, or if you're into like video games or tabletop gaming, maybe the amount of stamina that you have in a day. And what we tend to see is that disabled individuals may have fewer spoons to start a day than non-disabled individuals. So for a person with, say, chronic fatigue syndrome, maybe they start the day with 6 spoons, and getting out of bed takes 1, showering takes 2, getting dressed takes 1, and making breakfast takes 1. They're left with 1 spoon for the entire rest of the day. And maybe that person needs to get in the car and drive to work and spend 8 hours working and then go grocery shopping and come home and cook dinner and all these other kinds of day-to-day life things. That can be extremely difficult, if not impossible, for a lot of individuals. Right? The amount of energy that some disabled people have is potentially going to be lower than the amount of energy that non-disabled people might have. Or it's also possible that just doing those day-to-day tasks when going through intense physical pain, or dealing with dizziness or vertigo, or weakness or low grip strength, or all kinds of other different experiences, that can make day-to-day life a lot more challenging. And so spoon theory, again, is just this idea that everybody has a certain number of spoons per day, disabled or non-disabled people alike. And the way that you can spend that energy, sometimes you have to kind of budget your spoons, and you have to say, I can't do the dishes today. I'm too tired. I've done too much already, or I need to save this energy for something else later today. While a lot of non-disabled people might not have to think about that quite as much. We also have this concept of spoon debt, where a person might do more than they really can handle for one day, and then they need a few days to recover. Maybe a person with a disability really wants to, go on a day out to the zoo with some friends and then go see a movie later and go home and do a bunch of chores and, grab groceries and just kind of take care of a whole bunch of stuff in one day. And then maybe they're going to need a few days, 3, 4, 5 days to recover and kind of rebuild that, pile of spoons so that they've got some energy again to go about daily life. So I think this concept really just calls attention to the fact that a lot of disabled individuals are having to work pretty hard to do things that are kind of typical or maybe easier for a lot of non-disabled people. It doesn't mean it's impossible, it just means it might take more energy, more focus, it might be a little bit more exhausting. And so if you have chronically ill or disabled people in your life, it's important to be flexible with people and meet people where they're at, and kind of just go along with it. If they're like, hey, I'm having a really tough day, my chronic pain is really bad today, I don't think I can do this, or I can't do that, or maybe let's be flexible and try something different, or just do half of what we had planned, or whatever that might look like, because it can be unpredictable. It changes, it ebbs, it flows, and that is one of the really difficult things about having a chronic illness or disability, is that physiological experience. Often it doesn't match what a person wants to do. It might not match their sense of self. It might not match what they psychologically or emotionally desire. But it is the reality that sometimes we have to be flexible and give grace and adjust to what our physical capabilities are in that moment. Unfortunately, when it comes to the disabled experience, there is one really problematic and troublesome aspect of disabled lives, and that is the experience of ableism and stigma. This is something that all disabled people will experience at one time or another, at different levels and in different ways and for different reasons in different circumstances. But this is a common experience just across the board for anybody who is living with chronic illnesses or disabilities. Ableism, of course, again, is the discrimination or bias against or towards disabled individuals. And when it comes to stigma, this is a concept that was really dove into by the sociologist named Erving Goffman in the 1960s. The perspectives that Goffman introduced are not entirely perspectives that medical sociologists and disability studies scholars today really tend to stick directly with, but This was an important jumping off point when it comes to the sociology of deviance, and especially in relation to chronic illness and disability. So what Goffman said about stigma was that it was a mark of disgrace, dishonor, difference, or a spoiled identity. So this is the idea that a person who is stigmatized or who has a stigmatized identity, they are living in dishonor. They are different in a way that is seen as bad. I'm not sure how familiar everyone in this class will be with the sociology of deviance. Deviance just meaning a violation of social rules or norms or conventions, right? Having a behavior or a body or a way of life that does not match society's expectations. And so a disabled person may be stigmatized, or disabilities and illnesses may be stigmatized in a way that frames them as deviants, right? Viewing disability as a break away from norms, a break away from expectations, and a difference in a sense that is negative, right? A pathologized, kind of very negative, dishonorable, disgraceful, shameful kind of difference. And a lot of people still do see disability in this way. Throughout our class, of course, we will learn that there are a lot of other things that we can, or a lot of other viewpoints that we can use when discussing disability. There are a lot of positives to the disabled experience, but that's not what tends to get the most focus in the discourse of our society. So let's think a little bit about how this comes into play in our day-to-day lives. Where are we seeing ableism and stigma pop up today? I'd like you all to think about what are some of the negative messages that you've heard about disability, or even just what messages you've heard in general. A lot of them might be negative, but that's not always the case. We can think about things that we've seen in media, right? In movies and TV shows, comic books, podcasts, all kinds of different places. Things that you've heard from your family or your friends or other peer groups, or things that you've heard from medical professionals and any other kind of source of messaging or socialization. There are a lot of different places that we are learning about disability from. When it comes to the media, representation of disability is a particularly problematic space where we tend to see a lot of disability representations being very negative. A lot of the time when we see disabled individuals in movies, they're going to be depicted as villain characters. If you think about really any villain that you've seen in a movie or a TV show, think about how many of them have facial differences or scars or burn injuries, amputations, medical technology that they use to survive. A lot of the time we see disability being used as a plot point to punish someone for their wrongdoing. If you're familiar with the character Two-Face from Batman, he's a villain who was essentially like a two-faced in personality kind of person. I believe he was the Attorney General of Gotham in the lore of Batman, and he ends up sustaining burn injuries to just half of his face, making him quite literally two-faced as a kind of plot device to punish him for his moral personality kinds of so-called failings. So we see a lot of negative messages in the media that really serve to continue this stigmatization of disability. We also see a lot of ableist jokes, a lot of use of ableist slurs in day-to-day discourse. I'm sure all of you have heard people use the R word. This is not a word that we should say, but for the sake of clarifying, in case anyone's not sure what I'm saying there, saying that something is retarded or that a person is such a word. That's something that we do see a lot in our society, and it tends not to be met with the same kind of outrage as people using things like the N-word or other types of slurs. Ableism is really ingrained and not always very combated or discouraged in our society. It's also important that we discuss, why is our society so uncomfortable with disability? Why do we have these negative perceptions, and why are we so afraid and uncomfortable with disability? And why do we, maybe feel some aversion to interacting with a disabled person, or just feeling very unsure or maybe nervous in those kinds of interactions? And that would be due to a whole lot of different reasons, but one thing that is important to this discussion is what we call the anyone, anywhere, anytime threat. And I put threat in quotes here because the idea that disability is threatening or scary or something that we should be avoiding at all costs, that's kind of a slippery slope. It puts us in a very tricky situation when it comes to adjusting to a disabled life if that is a situation that you encounter. So the anyone, anywhere, anytime concept is essentially that any person in any place at any time can become disabled. And this could mean developing a disability through a chronic illness, sustaining an injury through an accident, say, a car accident that leads to a leg amputation or an ear infection that leads to deafness. There are a lot of different ways that a person can acquire a disability. And I know when we talk about this, a lot of people feel this very visceral fear reaction, right? We are taught that becoming disabled is terrifying, is scary, is tragic, but that's really just one part of the story, right? That's one perspective or one version of the messaging that we receive about disability, and it doesn't have to be that way. Of course, it can be a very difficult, traumatic experience for a lot of individuals. There are also a lot of parts of disability and disabled lives that are not scary, that are not shameful, that are not uncomfortable or traumatic or tragic or any of those things. A lot of people, it simply is, right? Having a disability is just part of life. It's a very normal part of the human experience. 1 in 5 people has a disability, right? 20% of individuals is disabled in some way. So this is a massive, massive proportion of all the people on Earth. And this messaging that gives us this very negative perspective that perpetuates ableism and stigma really doesn't serve the disabled community, but it also doesn't serve those who are non-disabled because it perpetuates these ideas that disability is a bad thing and a scary thing, and it leaves us in the dark as to the reality of the situation, which is just that disability simply is. It doesn't have to be anything that we, qualify or value or devalue or moralize in any different way. It can just be a simple fact of life, and it doesn't have to be something that we feel threatened by, but we tend to see that happen pretty often. So next time you're feeling that way about disability, or you hear someone else having these kinds of thoughts or sharing these kinds of messages, try to kind of question that a little bit and think, is this accurate to real life? Is this something that is maybe just a little bit of a pessimistic sort of framing? And just really kind of try to challenge those ideas because that is just one side of the coin. When it comes to the experience of ableism, of course, we know that people with visible disabilities might experience ableism in a different way than those with invisible disabilities. People with visible disabilities might experience more ableism from strangers, meaning that in their day-to-day life, people who are, grocery shopping or out and about in the world, doing whatever it is that they're doing with their day-to-day lives, they might encounter more people coming up to them, talking to them, asking personal questions about them, or objectifying them, or using them as a teaching tool for, maybe their children. And this can be a very difficult experience. People can be, very like they might have their heart in the right place in these kinds of interactions. They might think that they're being friendly or that they're being helpful or all kinds of different things that are good-natured. But this is, in a sense, a form of ableism because that person is picking out a disabled individual from the crowd and treating them differently, potentially infantilizing, objectifying, or just inconveniencing them in a way that would not happen to somebody who is not visibly disabled. When it comes to experiencing ableism, it's also really important that we have an intersectional perspective where we look at how other identity factors like a person's race, gender, sexual orientation, socioeconomic status, religion, all kinds of different identity factors, how those interplay with their disability to transform the experiences of ableism that they might have. How would it look for somebody who is white versus a Black or Indigenous person of color? How would that potentially look to experience ableism, or specifically in medical settings or in the workplace, or interactions with interpersonal relationships such as romantic partners or friends. This can look really, really different for people depending on the unique collection of identities that they have. And particularly for accessing medical care, certain identities or certain groups of identities may be more or less likely to experience mistreatment compared to high quality medical care, or a more difficult to access versus easier to access kind of diagnosis, depending particularly on socioeconomic status, but also gender and race being huge factors here. Um, that's going to have a really, really big impact on what ableism looks like for that individual and what their unique experiences will look like in their day-to-day life in the world. We can think a little bit about that lived experience of being a disabled person and experiencing ableism. What kind of impact this really has on a person is going to have a lot of nuance, right? What is going to happen when a person experiences ableism from their family members compared to maybe from their friends or employers or their coworkers, from medical professionals or from representations in the media? All of these different scenarios are going to feel very different and have a deeper or shallower impact on that person and their emotions, their experiences, and their opportunities and their day-to-day life. The way that your family treats you compared to the way that your coworkers treat you has different implications for your day-to-day life and your well-being. If you're treated particularly badly by an employer, that could potentially jeopardize your financial situation. That could potentially jeopardize your living situation. For medical professionals, that could, of course, jeopardize your health and the treatment you can receive, how things play out with your illness in your day-to-day life. There are a lot of different impacts that we can see when ableism takes place in these different kinds of settings and scenarios. So think a little bit about, those nuances of experiencing ableism or discrimination of any kind, racism, misogyny, homophobia, and so on. All of these kinds of experiences of discrimination, depending on where they're coming from, can have very different impacts. All of the impacts are, of course, potentially huge, extremely harmful, extremely detrimental, and very, very difficult to deal with. But it's going to look a little different depending on where it's coming from. And dealing with those experiences of ableism is also going to be very different depending on where they're coming from. Particularly in looking at difficult experiences within medical settings, the medical system, particularly in the United States, is not very disability friendly. It has a lot of ableism built in. It tends to run off of the medical model of disability, this idea that disability is a pathology and a problem that we need to fix and cure, and that disabled bodies are broken in a sense, right? All of these very pessimistic medical model kinds of views. And so it's really important when you are a person with a chronic illness or if you're disabled that navigating this system is very tricky, and there are a lot of different things that can be helpful to make it a little bit easier and maybe potentially a little bit less detrimental to your overall well-being. First and foremost, social support is really, really important. Having trusted support people and loved ones that you can potentially have accompany you to appointments, or people that you can lean on in difficult moments, whether it be difficult moments in terms of your symptoms and your physiological experience, or people you can connect with about your experiences through things like support groups. There's a lot of different ways that a person can access social support and community, but that is really, really important and really key to navigating the experience of illness and disability. It's also important to self-advocate in every way possible. It is not an easy thing to do, but advocacy in medical settings in particular, being able to stand up for yourself and say, hey, why don't you want to look into that? Or why don't you want to order that test for me? Or seeking out a second opinion, or advocating and saying, all right, like, will you please note in my chart that you are refusing to order this test that I would like to have done? Will you please put that in my chart? Really, advocating for yourself in those medical settings, trying to make it so that you have that support and level of care that you deserve that is not always immediately accessible to everybody. Of course, there's a lot of reasons why self-advocacy is difficult, but I'll give a few tips on the following slides about how to advocate a little bit more, how to make that a little bit easier, because that can go a really, really long way in medical settings. And then, of course, financial resources and other assistance go a long, long way. So there are a lot of opportunities to access financial resources through the government, through crowdfunding. We also have some resources at UCCS that you can take advantage of if you're working with Disability Access Services or the Disability Services Office. There are so many different resources. The Dean of Students can be very helpful in this regard as well. If you're struggling to, access your, a diagnosis or access medical care, the medical center on campus or the wellness center on campus can also be a really good resource, and a lot of other things that people in your life can do that support people, and different organizations and nonprofits can do that can provide other kinds of assistance that can go a really, really long way. So don't be afraid to ask for help. Don't be afraid to use your resources. If you are navigating the system, even if you have no disability at all, even if you don't have a chronic illness, maybe you even don't have a transient illness and you're just preparing for any kind of future interactions you might have with these systems, all of these things, social support, self-advocacy, and using your resources can be really, really, really important and helpful. When it comes to self-advocacy at your doctor's appointments, it's really, really important that you can arrive prepared. So going in knowing, exactly what you want to get out of that appointment, maybe have some expectations of, these are the things I want to talk about, these are the symptoms I'm dealing with, this is what is troubling me, this is what I want to see happen. Kind of thinking about these things ahead of time so you can arrive prepared. And to make that even easier, bringing notes can be very, very helpful. Sometimes it can be stressful to be in a doctor's office or to be in a medical scenario, and so having things written down can make it a lot easier to remember, okay, here is my list of symptoms, or here are questions that I have, here are goals that I have, or treatments that I'm curious about, or whatever might be relevant to your situation. And of course, doing some research ahead of time can be really, really helpful in that scenario of saying, hey, I know people with my same condition have tried these things. I'm curious about this list of treatments. Or here's my list of symptoms. I think, these are some potential conditions that sound like kind of similar to what I have going on. What do you think of checking for any of these and seeing if maybe one of these could be my diagnosis? A lot of doctors might kind of discourage you from doing research ahead of time, but trying to be informed and trying to just learn a little bit more about possibilities of what might be going on, or what things you might be able to try, or goals you might be able to set for your own health and well-being, that can be really, really helpful to go into, even just for your own sake. Also important to be honest about how you're doing. I know we're all so conditioned that when someone says, hey, how are you? You just say, I'm good. But if you're at the doctor, especially if you're dealing with chronic illness or severe symptoms or anything that you're very concerned about, try to be honest about how you're doing when they ask, right? If they're saying, hey, how are you today? You don't have to say you're doing well if you're not doing well. So try to be honest about how you're doing so that you might be able to get, kind of cut to the chase a little bit faster. It's also important if you do have a diagnosis that you know what your diagnosis is, that you've got your information straight there, you've done your research, you are educated on your condition, because not every doctor will be. Unfortunately, a lot of GPs or urgent cares, these general practitioners and PCPs, they don't know everything. Physician's assistants and nurses don't know everything. And so if you can kind of be a beacon of knowledge in those scenarios, then it makes it a lot easier for people to work with you if you can kind of educate them and include them on information about your diagnosis and your goals. It's also important to keep it straightforward. Try not to ramble too much. I know I'm rambling a little bit during this lecture, but during your doctor's appointments, try to keep it nice and to the point as much as you can so that you don't get kind of lost in the sauce with that diagnosis or treatment experience. And then, of course, you can seek additional opinions if you feel that you are not being listened to, or that maybe there are just some unanswered questions that your current practitioner is not really helping you to get to the bottom of. And finally, leaning on support people and loved ones for support during difficult moments, or even having people accompany you to your appointments, that can be really, really helpful as well when it comes to self-advocacy. So, in conclusion, the experience of illness and disability is a very nuanced, complex, and very personal kind of topic, but it's not something to be ashamed of. It's not something to be afraid of. This is the most normal part of the human experience that there really is. Every single person on earth gets sick occasionally. Some people have chronic illnesses, other people never develop chronic illnesses whatsoever. Some people are born with disabilities and others acquire them later on, and some people never become disabled over the course of their entire lifetime. So, regardless of what a person's situation looks like, illnesses and disabilities are a very normal part of the human experience and nothing to be afraid of. They're something that need more attention and more research so that we can deal with these things better in our society. Um, we talked a little bit about the anyone, anywhere, anytime so-called threat. I think it's really important that we have a positive spin on disability in this situation. We know that anybody can become disabled at any time through a lot of different means, and it doesn't have to be scary. It doesn't have to be bad. This is just a part of being alive. As people get older, you have more illnesses throughout the course of your life. You may become injured at more points throughout your life, or you might go through some kind of accident. And all of those things can be really difficult to deal with. Don't get me wrong, that can be really, really hard. But it can also just be part of the human experience. And it's something that you can move forward through and move on from. And you adjust and you become a new person, maybe with a new identity, but you're still you, and you can still have a really kick-ass, amazing life with or without a disability or a chronic illness. Another thing in conclusion, it's very important that you do your best to support yourself, advocate for yourself, and also help the other people in your life who might be dealing with these experiences. The experience of illness is not easy. It's not always very straightforward. It can be messy. It can be difficult. But with support and with resources and with asking for help, there are always, always options. There's always hope, and things can always, always get better. So definitely, lean on those support people, use those resources, take care of yourself, and take care of the other people in your lives. All right. Thanks for being here with me this week.